Scuba diving can be a great experience. Every year, 250,000 Americans put on a wetsuit and jump in the water to explore the undersea world. If you're properly trained, scuba diving can be very safe, but there are a few common medical conditions that can make diving dangerous. More on diving safely from Mayo Clinic.
We're getting ready to dive.
Mayo Clinic Dr. Jerry Sayre is a family medicine specialist who also studies dive medicine.
Sport diving is a fantastic experience.
But in order for scuba diving to be safe, Dr. Sayre says you need to be healthy.
There are no hard and fast guidelines. However, medical consensus suggests that people who dive should not have diabetes, should not have asthma, and should not have a seizure disorder.
Insulin-dependent diabetics could pass out underwater if their blood sugar gets too low. People with asthma could have an attack underwater, and so could people with seizures. So if you're sick at all, it's best to stay ashore.
But if you had a bad cold, you probably should not dive.
You have to be able to clear your ears. All divers need proper training to avoid ruptured eardrums or even the bends.
The bends is another term for decompression sickness.
As you descend, increasing water pressure forces nitrogen gas from your bloodstream into nearby tissues. That alone isn't dangerous, but as you ascend and pressure decreases, the gas leaves the tissues. If you come up too quickly, the gas leaves too quickly, forming bubbles which can damage your muscles, joints, heart, or even your brain.
That you probably should never come up faster than your smallest bubble.
So if you're on vacation and you want to do an open ocean dive or a cave dive like this, go ahead, but be smart about it. Don't go in if you're too tired, if you don't feel well, or if you've had too many pina coladas the night before.
It may interfere with some of your judgment.
So to make sure diving is safe for you, talk to your doctor and then enjoy the wonders of the underwater world. Some of the main organizations that train divers include the Professional Association of Diving Instructors, PADI, the National Oceanic and Atmospheric Administration, NOAA, and the YMCA. Again, diving can be safe if you're properly trained and healthy. For Medical Edge, I'm Vivian Williams.